Hello everybody. Today we will discuss Argentina Flag Sign. This would have happened to most of us in our career. So why does Argentina Flag Sign happens? In any case of intumescent cataract, we'll see that the intracapsular pressure is very high, which leads to radial extension of the capsulorhexis as soon as we try to start the rhexis. The term Argentina Flag Sign came as it describes the condition due to its resemblance to Argentinian flag, which has a color pattern of capsular staining above and below and centrally white patch which represents the cataract. Let's proceed with the video's discussion. Here you can see that our resident is trying to perform the rhexis, but due to raised intrareticular tension, the capsule tears away and gives the Argentinian flag sign configuration. So what we have done is we have entered the antechamber from the main port and we are trying to make two curve nicks with the help of vanas. This curve nicks will help us to form few flaps, which flaps can be held with the rhexis forceps and gently curved around. This way we can have certain amount of rhexis which is the intact, that is on nasal and temporal side, but whereas we have a limited rhexis at the 12 o'clock and 6 o'clock position. Now I am trying to deliver the nucleus bimanually so that it is as much as atraumatic as possible to the rhexis as we expect it to extend posteriorly. Now we are coating the nucleus and using the vectis to deliver the nucleus smoothly. Once the nucleus is engaged well in the vectis, we will deliver the nucleus out. After this, we have to do cortex wash. At the time of cortex wash, we have to be very careful that we don't catch the free fibers of the capsule, because the capsule is slightly compromised. There is very high likelihood of capsule getting stuck in our Simcoe. We have to be very careful that we do not catch the capsular flaps and remove it. We have to slowly remove the cortex, and once the cortex is cleaned, then we will go ahead with the IOL implantation. We have injected visco to inflate the sulcus. Once the sulcus is inflamed, so we have a area where we can implant the lens. Because the capsule is compromised, we have planned for a 3-piece IOL in sulcus. So here you can see that there are sulcus which is intact on temporally and nasal side. So our both the haptics will rest on both the rhexis, and this way we can stabilize the IOL very smoothly. Once the IOL is stabilized, we will close the antechamber with the help of one suture just to prevent any wound leak. There are several techniques which have been advised for Argentinian flag sign prevention, as the surgeon can anticipate it in case of a pressurized capsule. First, we aspirate the liquefied cortex with the help of a 27 gauge needle, and then you can use high cohesive viscoelastic device, so viscoelastics, to pressurize the anterior chamber against the pressure of the intumescent cataract. Then you can use the Phaco tip to do a punctorhexis and simultaneously aspirate the loose liquefied cortex. Then we can do two-stage capsulorhexis, that is like a snail track or an onion peel. We'll do a double rhexis. This way we can keep the rhexis in control and prevent it from extension. Thank you for your patient listening. Do subscribe to my channel.